All right. So it looks like we just hit the top of the hour. So we're going to go ahead and get started. So first of all, good afternoon or good evening to you, depending on where you are watching us from in the world. We do recognize that there are some of us who are dialing in from the African continent, some perhaps from Asia as well. And we have those of us here in the United States. So clearly we're in different time zones. So we welcome you officially to this month's episode on the Bridge Leadership Room webinar discussion. This is a platform that is dedicated to educating and equipping today's leaders with resources and information and principles that will better prepare them for tomorrow's opportunities. And we couldn't have had it any better that for the first time ever since we started the Bridge Leadership Room, we have two awesome facilitators at a time who will be talking to us about a topic which is very vital in our lives. I mean, this is a topic that perhaps every individual must learn about. Even if you're not going to be a leader tomorrow, you need to understand that today and how it contributes to the trajectory of your life, down the line. So today we're talking about mental health awareness, and especially in the sphere of leadership. So I have with me today two awesome gentlemen. One, Dr. Olele, I've known for many years now. He's actually like a brother, a big brother of mine, and he's a board certified psychiatrist who deals with depression and anxiety, and he runs his own firm called Genesis Psychiatric Solutions. And they do some really awesome work in the DC, Maryland, Virginia area. Then we have my friend here, Philip Fori to me, who is a phenomenal man who's actually doing some great work in the area of mental health awareness and has really taken this upon himself to want to educate the masses to help with the stigmatization that really encompasses around mental health and its challenges. So, gentlemen, you are very welcome to the Bridge Leadership Room.
Thank you, sir. Thanks, brother.
All right. So before we actually go any further, just a few housekeeping matters for the members of the house. If you have any questions, please feel free to drop it in the chat as we're talking, because at some point we're going to take questions from the audience. They have about 40 minutes to give us all the knowledge they possibly can give us on this topic. So I'm very, very excited. And also, if you know anybody that needs to be connected, just make sure you just send them that registration link, or if you're on Facebook, just forward it so they can also join in on the discussion. So before we kick off, I'm going to say, first of all, gentlemen, if you can tell us a little bit about why you decided to take the path of mental health. So let's start with you, Phil. Why mental health? Can you hear us, Phil?
Oh, yes. Sorry, I thought you said Dr. Uh, so why mental health? Wow, that's a good question. This is how my path started. Started with nursing as a floor nurse, and I worked in a nursing home for a couple of years. And after that, I felt that there is really, especially in the African community, for people to understand what mental health is. So when I had that feeling, then I wanted to delve more into what mental health really is about and why we have that perception from, and then because I see it differently here in the States. That to work in a mental health facility, inpatient. So I worked there for a couple of years, rose through the ranks and all of that. As I studied and practiced in mental health, I realized that the disparity between what we think it is in Africa, for the most part, versus what it actually is in the West is very wide. And that really doesn't account for much of our productivity and our well-being in general. Hence, I developed more interest in it and then studied
Thank you.
further to gain my certification as a psychiatrist.
And I'm glad that you mentioned productivity and our overall well-being. I think we're going to come to that. That's a very, very important statement there. So let me turn to Dr. Olele now. If you can tell us why you're passionate about mental health.
Yeah, I'm passionate about mental health because, first of all, I feel like the brain is the most powerful organ in our body. The brain is responsible for our mood, our movements, our personalities. So that's what drew me to pursue it as a pre-med student, as a medical student, and eventually entering the field of psychiatry, because I feel that it's a neglected part of our overall health. And being a physician, we treat the whole body, but for me, I wanted to specialize in treating the brain, and so that was a big component of reason why I wanted to be in mental health.
Right. Thank you so much for that. Now, I want to talk a little bit about this because I had an opportunity to watch a TEDx video by one CEO who mentioned that there was all kinds of pressure and stress to perform, in so much that nobody actually took the time to even check up on him, or he did not even take the time to take inventory of himself. So let's really start with this question, and any of you can go ahead and answer. Now, why is it important for us to really take our mental health seriously? I know it might sound like a very simple question, but why is it so important, especially in this day and age? Why is it important?
I would start by saying that, first of all, there's no health without mental health. If I'm not mentally healthy, who cares if I have hypertension or diabetes? If I'm not mentally healthy, why would I care about anything else about myself? So I have to be mentally healthy, mentally stable for me to care about my physical health. That is why it is very important that we understand the mental health discussion. The other thing also, there's a slight difference between mental health and mental illness. So you may be healthy but not necessarily ill. So it is very important that we understand the discussion, because in the absence of that, then especially from the African community, we perceive mental health conclusively to be mental illness, which is very wrong. And that is why we have to break that stigma and then talk about the difference also.
Absolutely. Can you tell us just a little bit about what that difference really is? The difference between mental health and mental illness. What
Okay.
is the difference?
What I typically try to do is use medical condition to relate it to mental health, right? Because most people are familiar with medical conditions, especially diabetes and hypertension. So, for example, I might have some slight raise in my blood pressure, and then maybe have some slight dizziness, but it doesn't mean that I am hypertensive. So I don't have the clinical diagnosis as high blood pressure patient, but then I do have elevated blood pressure and maybe some symptoms. So when it comes to mental health, I might have some traits, some conditions, certain things that makes me unhealthy mentally, but then I'm not mental. So I might not have depression, but I might be having some depressive symptoms. I might be going through certain things which cause stress on me and makes me act one way or the other, which may be a symptom of mental health condition. But then it does not mean that I have that diagnosis. So the
I
point
see.
I make is you don't have to have the diagnosis to realize that I do have the condition or a trait.
Thank you so much, Mr.
Sure.
Phil. And so, Dr. Ife, and you as well, can you shed some light about why this topic on mental health is very important in this day and age?
As Kofi, thank you for that question, because especially with the COVID-19 pandemic, more than ever, mental health is important because we are dealing with health stressors, with people being scared and anxious of getting the COVID-19 virus. People are experiencing financial stressors because they've been laid off, furloughed, or they cannot maintain their job or their business. So when you're having these financial stressors, that can affect your mental health. And so we're looking at all these attacks on our well-being, where people are not able to socialize anymore. So now people are what we call social distancing. I like the term physical distancing because you cannot really be interacting with each other. So with that, I met people who are feeling lonely and isolated. And so when you're having these stressors, it's going to be attacking your well-being. You may feel depressed, you may feel anxious. And so overall, our mental health during this time period is very important for us to pay attention to.
Thank you so much for that, because I'm really thinking, especially now that both of you have given us some light around mental health, mental illness, understanding the difference. I want us to talk about what seems to be almost kind of like a stigma, because I'm really curious about why the stigma around mental health. I mean, you've had the experience, Phil, you talked about working inpatient wise, and I know Dr. Olele, you've also been seeing patients, throughout the course of these years. So, what do you think in your experience is causing this negative stigma that surrounds, mental health?
Yeah, Kofi, the stigma runs deep because a lot of people don't want to be seen as vulnerable and weak. So that's one of the things that the stigma develops from, and lack of information and stories and that people have passed down to each other in their families about mental illness. Because a lot of times people that are hesitant or have that stigma are always say, I don't want to be crazy. I don't want to be seen as this. And it's a huge weight. And it's kind of like somebody feeling like they're the monster or the not. So that's what a lot of them do feel, is that they're different, and nobody wants to feel different or isolated from everybody else. But in this country, or in just the world even, if somebody has asthma, we are very supportive. We're always saying, take your inhaler. If somebody has high blood pressure, you see a lot of people saying, okay, maybe you want to calm down on the salty foods, or you want to calm down on things that could cause your blood pressure. They're like, oh, calm down. Or if somebody has diabetes, we're always supporting them to take their medication or calm down on sugar products. But with mental illness, a lot of times the stigma is, it's just a figment of your imagination. It's not real. You'll get better, man up, or something like that.
Thank you so
Okay.
much. And what about you, Mr. Phil? Can you shed some light on that as well?
Yeah, I think typically what you hear is, "Oh, knock it off. You be alright. Quit being a baby. Put all your big pants on." It goes beyond that. And part of the stigma also is because of our culture. The stories that we've been told over the years is spiritual. It's something in your family. And I really like to relate it to the Ghanaian culture, by extension, the African culture, right? Because most of these are part of what we've gone through over the years, and that is why we have that stigma attached to it. And also because we also don't have the extent of knowledge as to what mental health really is. So in most cases, it's been that the typical person that we refer to as being mentally ill will be the schizophrenics. So we don't take care of the little things, we don't take care of the minor stuff. And then sometimes it exacerbates to that level. Then you see a schizophrenic, and then at that point, because mental illness is associated to that person on the street, the naked person, the homeless person, then if you tell somebody that you have a mental health issue, then they feel offended, because in their head, you are equating them to that person on the street. But really, it goes way beyond that. And as I said earlier, there are so many other things that encompasses or is part of mental health. And if we don't take care of it, it affects so many facets of our life, and not just us, the people around us also.
Thank you. I'm glad you mentioned that, and I like that you said also, and I believe Dr. If you mentioned a bit too, that there's different aspects that encompass mental health, right? I want us to really now look at this from the lenses of a leader. All right. So, Dr. If you mentioned that COVID-19 has brought about all kinds of stresses. I believe Mr. Phil did nod his head in agreement. We can all agree to that, right? There's so
Right.
many unknown situations that have come out of this, companies that have to realign, organizations that have to stop the bleeding, relationships that are being hindered. I mean, there's just so many things that have really erupted out of this challenge, right? So, from a leader standpoint, if let's say if I'm a leader and I'm really kind of leading the ship, whether it's an organization, whether it's my home, or even whether it's any position that I've been placed in, what are some of the signs or symptoms that can be reflective of the fact that I may be experiencing a mental health challenge?
As in regards to as being a leader struggling with mental mental health, one of the things that I always talk to when I do speak with people who are like executives or leaders of organizations is remember you're human too. You have a family, you have a life, so you have all these compounds. So you're allowed to feel, you're allowed to go through pains, but when you find yourself feeling vulnerable and stressed, get help. That's like the best thing. Seek out help, support. That could be through talking with fellow executives in your circle who could bounce ideas, and so you could not feel alone. But then, if you want to take it to the next level, seeking professional help and assistance, because being an executive and a leader, you show your strength by even asking for your help. And when you're the people that work under you seeing that, well, he's getting help, I can get help as well. And that's where the stigma breaks down when we could make it open that you're not feeling well, but you're able to still lead, but you're seeking the right remedies to treat your problems.
Thank you so much. And what about you, Mr. Phil? Any thoughts around some of the symptoms? Because we want to be, I mean, it's easier for me to be defensive, right? If somebody just said, well, I think you're going through some mental health challenges. Well, what are the symptoms for me to be able to now be aware of these triggers or perhaps any type of behaviors that may tend to show that I might need to take care of my mental health as a leader?
All right, let me start with this. There's this saying that show, don't tell. So, as Doc rightly said, you as the leader will have to take that step of seeking for help, of breaking the grounds, talking about it. Then it lightens the atmosphere for other people to also talk about it. That is the first thing. The other thing is because of the amount of stress that is on you, and most mental health conditions are caused by stress or stresses, right? So, because of the amount of stress on you as the leader, you are vulnerable to most of these things. So, first of all, you really have to know yourself. You have to do a self assessment and then know your baseline. Then, whenever you are moving away from your baseline, then you can say that, at this point, I might have to stop and then take care of myself. And in doing so, it comes in so many ways. You can stop and then do other things to rejuvenate and then come back. If it's getting to a point you might need somebody to talk to, you have to talk to someone. Need a professional to talk to, you have to talk to the professional. So, in answering your question, how do I know? The first thing is to know your baseline, the starting point. This is who I am. Typically, I like to go out for basketball games, for soccer games, for golfing. I like to sit on Friday afternoons or evenings with my friends. I like these activities. If there's so much stress going on for which I even missed whether today Kotoko and Haas was playing, for example. Or Bayern Munich, let me use that one. That's a good one. Barcelona and Bayern Munich are playing, and all I saw is 8-2 scores. Then I realized I missed something big, right?
Right.
You're missing the little things that you took interest in. Then you realize that there's something for that mentally wrong.
Yeah, and
Wow.
just to piggyback off that, I love that example too. And another thing, the basic things I also look for and I ask patients are, how's your sleep? Are you
Mhm.
find yourself you're sleeping too much or sleeping less, or you're waking up more early? So that's something I gauge into. I try to find out their appetite, if they're stress eating or not eating at all. And I even ask about their libido as well to see what how that is affected, their stress is affecting their libido as well, or their concentration, so and their energy level. So there's different aspects of a person's life. Like I love how you said about the baseline and just knowing that and just seeing where things are rising up or falling down.
Kofi, let
Thank
me
you.
say
Thank you,
something
sir.
funny
Yeah, go
right
ahead.
here,
Go
right?
ahead, Phil.
I was providing a mental health education at a church in New York, and I talked about depression and how some people stress and how some people don't eat. And someone was like, "Oh, from Ghana, because of poverty, when you're depressed, you usually don't eat. But in America, there's abundance of food, so when we depressed, we eat. So depression presents differently in different people. That's the point I'm trying to make. For some people, they will not be able to eat. For some people, they'll eat too much. For some people, they will not be able to sleep. For some people, they sleep too much. So it could be that way.
Definitely. Thank you so much. Now let's talk about some ways that maybe we can address this stigma, right? Because you did mention, ways that sometimes our stressors might cause us to land into mental health challenges, and also, perhaps the activities that we once enjoyed begin to diminish in our lives, because there's an imbalance or a lack of a baseline, perhaps, right? So let's talk about how we can really deal with this stigma. Because coming back again to the TEDx talk that I watched, this was a man that was actually CEO by the age 31,
Mm.
and he's talking
That's
about the
really
fact that, I mean, like you said, that's awesome, right? Everybody's just thinking, wow, that's impressive. But he said, the way I could think about it is taking an elevator, and the key goal is making it to the fourth floor without knowing what is happening between second and the third before I get to the fourth. And he talked about the fact that, there were certain attributes and behaviors while he was growing up where he was just told, just suck it up, where he was just told, you're a man, you can't handle things this way, so on and so forth. And so now he's thinking that as a leader, when I come out to talk about the fact that I'm struggling, perhaps it might hinder my career, perhaps it's going to, make me lose credibility, or maybe they're going to make some other decisions and say, you're not fit for this job, right? So what is it, in your experience, would you say could be some of the ways that we can truly address these situations?
Yeah, that was like a very powerful explanation you met with the struggles and stressors that CEO had because, like you said, he's ambitious, but then with the corporation, he's also responsible for the lives and the livelihoods of the people under him because if the company goes under, then all these people lose their jobs. So those are things that um, will can play take a role. So like mentorship is very important for somebody just to talk to see the path that they've taken. I think that's good for leaders. Then I feel like when with this type of person dealing with a lot of stress, being in the right professional networks is also good because you're able to bounce ideas, not feel isolated. So that's a lot of pressures that high achieving people sometimes can feel like they're an island on their own. So just having that social awareness where you're networking with people that you could share ideas, and then also seeking the help of a coach or a therapist or a different coach who is somebody that will help guide you to your goals, or a therapist is somebody you can speak to about your problems, which is stemming from the past or present, and they can help you work through these things and help you with your thought process and help you lower those worries. But if it's getting to the point where therapy or lifestyle changes are not helping, you may seek medication management, which can help with depression, anxiety, attention issues. So just utilizing those resources can help a leader be more effective and help them with their self-care as well, because that's most important.
Absolutely. Thank you so
yeah.
much. So just based on everything you share, for those of us who are just following along, I was just taking some notes because I know I need this for myself, right? So Dr. If he's talking about mentorship, being in the right networks, having a coach or a therapist. So if you're a leader, perhaps, this is all having to be able to afford that, right? I mean, whether it's a mentor, that affording of that mentor might just be your time. It's not everything that might be monetary wise, right? Just really availing yourself, and of course talking about right professional networks, talking about coaching and therapy, and then you spoke about the medication side as well. But Mr. Phil, can you shed some light also in your experience around how we can really address this stigma of mental health?
Okay. So, as the leader, let's start with this. You are as good as the people around you. So, let's recognize problems are, or in this case, mental health challenges that we might have. As you mentioned, this is a high achieving person. So most people will be backstage clapping for him that, hey, he's doing well. See you at 31, getting this, doing this for himself. But then we don't know the challenges that he's going through, right? So we have to realize that there are certain conditions by their it makes people to act one way or the other, and in some cases out as high achievers. Okay, but then that is also probably because of their mental health that they have. So now, that being said, once that I know that I do have it, then I have to, as doctors, have professionals around me that can help me. Having a therapist board, which could play other roles also, because you mentioned ability. So I might not have just one therapist, one mentor, one this, and too many people just filling one bucket. But then you can have maybe one person who can fill various buckets. In talking about dealing with the stigma, that therapist also be there for the staff and not just the CEO. So providing that environment for the staff where they have someone they could go and then talk about whatever they're going through, either personally or professionally, and knowing that it's in confidence and it's with a professional helps to destigmatize the environment, right? So it
Yeah.
helps the eyes and then keep it going. What also do for both the CEO and the staff is they have like break time where it's not minutes break, but they might have a quiet room, at the organization where you can take some time off, sit in there, relax, rejuvenate, and then come back to work. There are so many other programs and activities that can be put in place to make sure that you're taking care of and your staff also. But we can talk more about
Wow.
it as we go on.
Man, this is great because I actually was at a seminar. I was at a global leadership seminar that was put together by my church, one community church in Texas, and
Mm,
one of the speakers shared something. I'm trying to remember the organization, but basically, what this organization does is that at the beginning of every day, they take a couple of minutes to reflect
mm,
about why they're doing what they're doing. And everybody closes their eyes and they spend time really kind of focusing on why they are where they are and what they're doing, and perhaps if there are any challenges to kind of process through everything that they're perhaps facing, and it gives room for that dialogue. It gives room for that opportunity to identify if somebody is struggling and they need help. So to your point, I think perhaps and organizations also need to create a welcoming environment that allows people to be themselves, right? I mean,
right.
you would think, yeah, because I think, it may not be enough for my boss to just say, hey, if you need anything, let me know. And another example I could think about is actually, I believe it's either the CEO or the vice president of McKesson, the global pharmaceutical company, that was speaking about the fact that everybody was so used to, hey, how you doing? And the automatic response, hey, yeah, I'm doing great. Yeah.
Yeah.
This is how I say
Like,
it.
hey,
They
yeah,
asking, they asking out of courtesy, not out of concern.
thank you.
It's
Hmm.
like, hey, how you
So
doing?
you
I'm
said
doing
out of
fine, and they keep
courtesy, I need to
moving.
write
It's
that
just
down. Yeah,
right.
out of
It's just out of
courtesy and
courtesy.
not out of consent,
Right.
because it's so easy for us to become autopilot to those responses. Like you just met somebody, hey, how you doing? Yeah, I'm doing well. Sometimes we actually ask while walking by,
Mm-hmm.
so we're not
Hmm.
even stopping. Like we're just rushing, hey, how you doing? Yeah, I'm doing good. So it's almost kind of like a lack of authenticity in those moments to
Right.
really kind of take a break. So what he actually said, which I thought was eye-opening, and I saw this article on LinkedIn, by the way, he said, I changed my approach and I started to ask, hey, what is the greatest highlight of your day? Well,
Mm-hmm.
can you tell me about your day? Because he
Yeah.
said he noticed that if I ask that question,
You
there's
start
definitely going to be something that will come out versus, hey,
Yeah.
how you doing? And just kind of keep walking. So as both of you were sharing about whether mentorship or organizational, professional development type, opportunities, I think that kind of brought that thought in there as well. And for those of us who are watching us, we really appreciate you tuning in. If you have any questions, what I want you to do, please drop them in the chat. If you're on the webinar, just drop it in the webinar chat. I'm going to make sure I take it up and ask our panelists who are here today. And if you're on Facebook, please drop your question in there as well, so that they can address that. Now, I just want to read just some few statistics that I found, which I thought was pretty alarming, and we just get into our next question. And it says that, 1 in 10 young people experienced a period of major depression. And it also says that 1 in 5 American adults experience a mental health issue. And also 1 in 25 Americans live with a serious mental illness such as schizophrenia or depression disorder. And these three facts alone kind of got me thinking, is there something I can do before it gets too late? Does that make sense? Like, is there something, because maybe I've not been taking care of my mental health, or maybe I'm beginning to see some signs, because I think what I'm seeing here means that it's not just for adults, even younger people can go through mental health challenges. Even like you talked about COVID, and right now with a lot of challenges as far as, kids now having to do virtual school where they can't see their friends the way they used to. I mean, there's so many things that have changed. So, what are some of the practical preventive ways, or perhaps if not preventive, what are some of the practical ways that we can manage, our mental health before it gets to become much of a problem?
Yeah. What I would say is going back to the to looking at what I look at is a concept called like the 8 dimensions of wellness, where it's different parts of a wellness, like your physical wellness, your emotional wellness, your spiritual wellness, your intellectual wellness, which are more internal factors. And then you have your external factors such as social wellness, environmental, financial, and occupational wellness. So looking at it more as your personal well-being, knowing like for you getting proper sleep, which is like your physical wellness, eating right and healthy, making sure that you're exercising, because those are mood boosting things. Emotional wellness, knowing how to cope with things, such as if you're angry, listening to a song that might help you out, or doing coloring or drawing just to keep your mood calm. Then spiritual wellness, knowing what your purpose is for, your prayer life, where you could seek God, or Bible studying with friends or fellowshipping with others. Your intellectual wellness could be with in regards to you finding new hobbies, traveling, things that could bring pleasure. And the social wellness, especially with times like this, staying connected with friends on social media or in person, if you have the opportunity to do so. Your environment plays a big role in like your your home. Is it conducive to your health, where you could come home and feel at peace? Financial stressors, making sure that if you're not having like food income coming in, it's going to affect your household and your livelihood. And most importantly, occupational wellness, especially for leaders, having purpose in your job, feeling that you're motivated going to the job you were going. Because if you're going to a job that you feel is a dead end job or you hate, it's going to make you depressed and anxious. You're going to be worrying all the time. You're going to be feeling sad. You're going to be like, why am I doing this? And you see how I mentioned all these different dimensions, they all overlap with each other. One goes down, it could affect the other. And so those are preventive measures before it gets serious.
Kofi, I think you're on mute.
All right, Phil, any thoughts on that as well? Can you hear me now?
Yes. So I would take perspective of where you talked about, in kids. Um, Most mental health conditions starts before the age of 12. So you have to realize it's not just something for the but once again, I also relate it to if a Ghanaian child is to go to the parents, or a Nigerian child is to go to the parents and tell mom, I'm depressed. Uh, I believe the response will be the same, regardless of whether it's Ghanaian or Nigerian. And you both know what I'm talking about, right?
Mhm.
What do you know about depression? I gotta swear, and they bring you the money, and then I'm not talking about depression. You are, and then go on and on and on. Let me say this: the culture in which we grew up is very different from what they are growing up in now. Hence, the challenges are also different. Therefore, the solution that was used to fix the problem of yesterday cannot be used to fix the problem of today. Okay?
Right.
Okay, so the psychosocial support system that we had growing up, where Kofi at Persec, you could just go to Legon and go play and all of that, is not available to that child in the school district in which you are. They have so much constraints. Hence, the challenges are very different. That is one. The second thing, we have to stay engaged and involved. And then let me loop it to as leaders, right? So as leaders, I've already talked about the baseline of ourselves. Now let's also talk about of our staff. How well do we know our staff? Can we tell when there's a difference in the way they're acting? Can we tell when they have some stress on them? Can we tell if they have some challenges at home? Can we tell if it's been different? I remember when I worked as the director of nursing, and sometimes I'll call some of my staff to the office and you don't, is everything okay? They'll be like, oh, no, I'm fine. I'm like, no, you've not been the same for the last 2 days. Then the next question is, how do you know? Because I pay attention, right? So to the little stuff, the way your facial expression just changed, the way you even walk changed because usually you walk fast. Today you are being sluggish, right? So those little things, are we paying attention to our staff? To where if there is a difference, we can then approach them and then lighten the mood for them to talk about it.
So,
This,
so I like what you were saying there. Just to kind of hold that thought there, Phil. So assuming you found out that maybe a staff member was struggling, and
mhm,
you noticed that there was maybe a change in their mood, their attitude, and they perhaps gathered the courage and shared with you. As
mhm.
a leader, how do you respond to that?
Okay.
Because I think sometimes, and I'm asking this question because maybe sometimes I already have a preconceived notion that if I said something to you as a leader, maybe you're going to think of me in a negative light. So I might as well try to kind of, scale back, even if I may not even share in its entirety what I'm truly going through. And
Mhm.
I'm really curious about your response because maybe there are some leaders who are watching that might not know how to handle that. It's not that they wouldn't want to address it the right way, but it's just they may not know how best to address it, in a manner where you create that environment and limit as much constraints as possible. So can you shed some light on that? How would you respond to somebody in that situation?
Okay, let me start from this. If there is no before, there cannot be an after. So if
Mhm.
you have that relationship with your staff, when you call them to the office, they are thinking of reprimanding them. So they're not going to even open up to you. Or they are even going to be thinking about, how is my boss going to see me now if I talk to him about this? Hence, they are not going to open up. Therefore, there has to be a before. You have to have that relationship with them. They have to be that cordial relationship. You have to their level. Then there's that. Then based on that trust, when you ask them these questions, they can then relay information to you. So that is the first part. Then the second part is most leaders fears of what they're going to ask and probably don't have a solution. Therefore, they practice it. They don't ask, don't tell. So though I do know that there's a problem, or I feel that there's a problem, I don't want to ask because I don't want him or her to tell me, and then I won't be able to give a solution. But sometimes just providing the listening ear is just good enough, right? Sometimes they just need someone to vent out to. The problem might be their colleague, it might be from home, it might be from the trusted friend. So now they don't know where to go. So they just want someone to express themselves to. So you providing that shoulder for them to lean on and then be able to express themselves gives them the comfort that they need. Probably that is all they need. They don't need a time off. But if they even do need a time off, let's look at this way: presenteeism versus absenteeism. Which one affects productivity, right? So when you were in school, primary school, probably, when your teacher comes to class and then doing the roll call, Kofi present set, then you have that funny like Kofi present out, right? But which means that Kofi came to class, but he's left the class right now. So we have people who go to work and will be physically present but mentally absent.
Mhm.
People cannot produce. So you check in the boxes of I have 6 staff, so I should expect X amount of productivity.
Yeah.
it's out. Hence, he's not there. But remember, you're still paying him. So it
Wow.
even listen. And if that person needs a time off, consider that. Accommodate one way or the other as much as you can. And concluding on this point, right? Now, you have a high performer who has a problem, maybe had a mother pass away, something drastic happens to that person. You only get 2 or 3 days of PTO. As Ghanaian as I am, days is not good enough for me because I got to cry 2 days and then fly out 2 days, right? And then do my funeral and then fly back. So it's not enough. I asked for more time off, and then you tell me, oh no, you can't give it to me because if you do, you're going to have everybody else asking for it. And that is typically the answer of a leader. Oh no, I can't do it because everybody else will want it. Let's remember, no two circumstances are the same. So you all of us the same. So now you don't give it to me, and then I go part time or I go PRA. How much do you end up losing?
Hmm. So I see that it's almost kind of like an adverse effect of what you deprive the individual,
Yeah,
where it might look like their presence is just physically there, but their real productivity and
is
their potential, yeah,
That's
it's
it.
really down.
That's it.
Wow, that is very eye-opening.
and Kofi.
Dr. Lele, you want to add to that as well?
Yeah, but I'm glad you highlighted the presenteeism and the absenteeism in business affecting the bottom line. But the thing too, on top of that, before preventive measures, is the type of culture that the leader wants to create. And and I think that those are good preventive measures where I like how you mentioned the leader that asked about what is the highlight of your day or the low light of your day. It's just knowing that, so that way the team knows that this is a community where they're open to communicate with each other, and that will give the leader who is receptive and that has a high emotional intelligence to know what is going on with their team, and then for them to build morale, such as things like celebrating milestones for colleagues, celebrating birthdays, doing baby showers, something to show that we are working and we're being productive. However, we recognize you as an individual. And so things that where I've seen organizations that have been successful are when they exercise together, like do walks, or they go to lunch together,
Mhm.
or they emphasize when you go on vacation, you stay on vacation. I don't want to see you texting us, emailing us. Go away. Go
Correct.
enjoy your paid time off. So I think when a leader fosters that as a culture in their organization, that will help allow open communication and for people to feel, okay, it's so good for me to feel good, because when you have low morale, a toxic culture, what does take place is where people are present and they're feeling like they're zombies, or they're absent. They have more sick days that they don't want to show up to work. So that's why it's important as a leader
Wow.
to have high emotional intelligence.
I really love this, Doc and Phil. I mean, you really opened a whole different dimension of mental health from a practical standpoint, especially since probably work might be the second place we spend most of our time,
Mhm.
right? And I'm just really thinking about, whether the right culture is in place, for individuals to thrive under that leadership, and also whether that leader is creating a conducive environment where it's going beyond just being there and doing your job, but really building those authentic relationships and finding moments where you can capitalize on that to maximize your productivity and to exceed your goals as a whole. So a question that has come in that I want to ask you guys this particular question, because what if I find myself in an environment where the leader may not be that self-aware, when it comes to, you know, mental health, or maybe perhaps the behaviors and the drivers around that office is not helping the team as a whole. You know, as an individual that may be now aware of mental health triggers and situations of that sort, what would be your advice on how they go about it to help that leader to come to that awareness?
So what some organizations do is have where you put in comments of what you would wish to see in the organization, right? In most cases, the comments that you get is pay raise, but sometimes we should be asking for mental health education, right, instead of pay raises. Money is good. Sometimes I can give you all the raise that you want, but it's still not going to solve your problem. So these intangibles is really going to make you have a good use of the money that you're making. So to your question, what ways we should be asking for mental health education in the organization? We should be having conversations about high performers, low performers, team building, how can we grow, and all of that. I think as staff, at least that is within our realm to ask for. And then also depending on the relationship that you have with your boss, you can then generate the conversation individually with your boss and let him or her know that I think this will be very helpful. Given that there's XYZ going on that I think partly because of this. So if we can look into that. Sometimes that
Absolutely.
becomes, sorry, can I go ahead?
No, no, yeah, please. Yeah, go
Okay.
ahead.
So sometimes that becomes the best way of solving problems without having complications. Because if you go directly to an individual or a group and try to solve the problem head on, you don't know the underlying factors. Hence, you are missing the basics. But then if you go backdoor and then present it as a bigger problem for the organization, then nobody takes it personally, right? And then they all see that problem of all of us, not just me. Right.
Thank you so much for that. It's interesting you say that before we get to Dr. Ifide. As both of you were sharing, I was just thinking perhaps maybe just creating a feedback-rich culture
Mhm.
can go a long way because I'm just thinking about how some organizations are just waiting till a 360 review. I'm just
Yeah.
waiting till the end of the year to do an assessment or a mid-year assessment. And that assessment majority of the time is just going to come back to how well you did performance wise, and it
How do I
leaves
remember what
out all
happened in
this.
March, in December?
Right,
Mhm.
exactly. Maybe for all you know, that person, was perhaps going through some challenges at home. Maybe the schedule of their kids became so crazy for them that they couldn't now manage. Just a whole lot of things that happen that I think sometimes we can get so performance driven that we can lose the value and essence of how when we take care of that mental health of those that we work with, it changes the dynamic of the outputs that we receive. So back to you, Dr. Lilly. Any thoughts around this whole discussion as far as us addressing this is concerned?
Yeah, another aspect could be committees. Like if the company, because the thing is that if the company is very incentivized and intentional about their actions about mental health, having committees that could be the task force engaging, like you're saying, collecting feedback, criticisms, or seeing anonymous, allowing anonymous um,
Mhm.
conversations or tips about what's going on in the mental health in the organization and how the leader could address it, and where the leader will be able to speak with the committee and find out where his blind spots are. And
Mm,
so knowing that that could be a benefit to the leader, and the leader could also take initiatives on his own by doing classes where they can learn about empathy, emotional intelligence, or learn about how to be more vulnerable or more approachable, and also watching their tone of the way they address people, because um, to communication is big and tone is huge. Because here's the thing, we all are different people, and so we all have different come with different backgrounds and histories, and you don't know if you come in an aggressive tone towards somebody, if that triggers reminders of somebody that was abusive towards them or bullied them, and that's where they might go into shock and not perform as well, and then
Yeah.
they're always avoiding you because you may be reminding them of somebody that you knew before. Or if you're a leader that was like passive aggressive, you may remind them of somebody that was passive aggressive towards them. So we're all not psychics or prophets knowing how people are act, but however, we just have to learn how to be aware of each other, our tone, the way we communicate, and just like self-awareness and awareness of your team through the constant communication or the open feedback. When you know your gauge and the temperature of your different coworkers, I think that will be an asset and a skill for the leader to know, okay, this person's kind of off. They're not engaging with people. Let me go to their cubicle or bring them to my office. Let's have some coffee and talk about some things that are in their mind, because you never know. It may be that they had an argument with their spouse, or their child is underperforming, or they have a sick relative that's on top of their mind. And it may not be work related, but it may be their personal life. And so those are things that a leader, I think that's one of the best skills a leader can have, is their emotional intelligence.
I love that you said this, because a question that just came in through our webinar, and both of you have to, just take this on, because I believe Roseanne said, do you think emotional intelligence factors into mental health? And if so, how can we capitalize on this? I mean, last month we had a lady speak to us at length on emotional intelligence, and I can see how this is not mutually exclusive at all. But since you have the experience, I want you to talk about this a little bit more. That how do you factor emotional intelligence into mental health and managing mental health as a leader?
I think one of the best things is learning how to be vulnerable. And that's one. I feel like empathy is a big strength of anybody that has emotional intelligence, because what empathy is saying is, I'm not feeling sorry for you. So that's not, I want to make sure we get that clear. So as a leader that's empathetic, you're not saying I'm feeling sorry for
Yeah,
you.
I have to write that down.
I want to understand where you're coming from, because like you could be somebody from Nigeria, or then somebody from Mexico, or somebody from US or Canada, wherever you're from. But the thing is, what the common things are is, we're humans and we want to feel. And understanding where somebody is struggling, you want to, even though if you never experienced it, you want to know where their struggles are from, and there you could relate to them, saying, I may not experience what you are going, but I'm here for you. I want to hear your point of view, and let's see how we could come to solutions, instead of judging them, saying, "Oh, if you had done it this way, or if you talk to this person, then you'll be you." The persons that feel like you didn't feel them, you didn't hear them, you didn't see them,
Right.
so they're going to tune you out, and that's where leaders lose people and retention goes down. So that's why it's important for those with emotional intelligence to. There's so many. It's such a deep topic, but just knowing where you could relate with others, your relationships, the way you come off, if you're coming too aggressive, you're coming too passive, or you're assertive. And so it's good to be assertive and confident, but also knowing how to relate to the person, because at the end of the day, when we're at jobs, everybody has different levels to their leadership. So so the way you come off to your team could also affect the bottom line, because then you have a lot of people want to leave, and then you have to now use HR resources to find new staff members to refill in. So, and then you start getting bad reviews as a company,
Yeah.
saying this
It's
is
like a ripple effect.
yeah, saying you don't want to work
Absolutely.
here because they don't care about you, and people want to be cared about.
That's true.
Yeah,
That's true. And I'm glad you said that, because there was a time I was looking for a job, and the number one thing I would always do is want to go look at the reviews. People want to see, like, what am I walking into, right? Am I
Mhm.
walking into a lion's den, or am I walking into, a very welcoming environment? But Phil, please, can you also tackle this question for us on emotional intelligence and how it plays into it?
okay, so not to sound sexist, but if you work in an environment where there's more women, you gotta know that your leadership style has to be very different from working in an environment where there's more men, right? Because emotionally, women react to things differently than men do. That is how it just comes out. The other thing also is, how would they want to be talked to? For men, how you talk to as a male, how I would talk to my colleague males is very different from how I would talk to my female colleagues or staff. The other thing also is, as Dr. Olele said, what their past has been, we don't know. And of course, we're not psychics. And that is why it's very important that you understand them. And the key word I keep using is understanding, right?
Understand.
You have to know where they're coming from, respect that, and then be able to fill in. we shouldn't go into discussion talking about stuff with our biases, because oh, this person is an African American, hence this is what I perceive them to be. And therefore, going into the conversation, you're going in with that bias. Um, you don't go in thinking that everyone is the same. I talked about female versus male, and then emotional. We're talking about emotional intelligence now. For some people, if they feel emotional, right? For some people, talking to them about very sensitive stuff, having your arms around their neck gives them that comfort, right? But then we also live in a country where sexual harassment is a very big deal. So first, do you know whether that person is comfortable with it or not? And that is why, as the leader, it goes beyond what you are comfortable with. You have to then go what the people want. So it is a huge task. But unfortunately, we tend to be task oriented versus resource oriented. Hence, were you able to meet your goals for the week, for the month? But as to, giving that room, giving that flexibility, were you
Right.
also giving them that? So in dealing with people is very, very different. But understanding the level of people that you're dealing with provides you the platform with which you can meet everyone at their needs. And if time permits, let's talk about personalities and leadership skills, right? Because Doc will agree that different personality traits present differently as both leaders and subordinates. So if you don't understand the personality, whether it's a disorder or the traits or any of that, then you might be missing a point. For some people, if you yell at them for something wrong, that will be the last time you see them taking the lead if they have avoidant personality disorder.
Right.
But if time permits, we can get.
Yeah, I mean, I'm really enjoying this conversation. I'm gonna be honest with you, but we have literally like 4 minutes or less left, and I want the rest of the audience to be able to hear a little bit about what you do profession wise as well. And I love that you mentioned that because I know my prior organization I worked for, we had something called the DISC test, right? So the DISC
Mm.
test is gonna help you to know those of us on the team who are the high Ds, the dominant people, the people who are like your high Is, your influencers, those who are situational and more adaptive.
Right.
And then those people like me who are more compliant,
Mm-hmm.
because I'm really that kind of guy. Like, just tell me what the rules are. I'm
Mhm.
very analytical by nature,
But that is
so
how most Africans are compliant.
true, true, true.
Maybe
Very, very compliant, but not perhaps that might not be our natural tendency,
true
but because
Yeah.
of the environments and the
environment.
systems that we
Exactly.
grew up in. So I'm learning from what you said earlier on, right?
That's
That
true.
our environments and how they shape our thinking, because ultimately the worst thing that anybody can find themselves in, I think, is to be in an environment where you cannot thrive by being yourself. It's difficult because over time it begins to wear out on you. It wears out on your health. It
Mm-hmm.
wears out because you can't even express if you're going through some challenges. And you have some organizations that might be like, we're very open to challenging the status quo. But then when you try to challenge the status quo,
You get in
you're
trouble.
pointed out as the bad man. So
And
there's
you're
so many
assassinated and
things.
you're out of the culture.
Exactly. So there's so many things that I really think, especially now that we find ourselves in this new normal, and this black swan of COVID-19, there is a tremendous opportunity for leaders and organizations, and even in our own personal lives, to take inventory of what it is that we're really seeing mental health to be, and not thinking, to Phil's point, not thinking that it means mental illness, because it's two different things. And two things both of you said that I wrote down, I never want to forget, Dr. Olele. You said empathy means I'm not feeling sorry for you. I think it's so important for us to remember that. And Phil, you said that we need to cancel out our biases. Man, that almost pierced me because I was just thinking, like, you know what? We all have biases sometimes. It's very easy for me to look for the person that looks like me, thinks like me, want to act
Mhm.
like me, to want to just associate with them quickly, or perhaps automatically assume that my own experiences are theirs as well.
Oh
And
yeah.
this creates, yeah, it's so easy for us to get into that kind of mindset without knowing,
And they'll shock you
what
too.
the journey. Yeah,
Right.
absolutely. Absolutely. But before we go, because our time is already fast spent, man, I wish we have more time. I'm really enjoying this conversation. Really, thank you guys. But starting with Dr. Phil, I know you run. Is it Feel Good Services? Yeah. So can you tell us just a little bit about Feel Good Services and what you do, how people can reach you, and then Dr. Olele, you can also talk to us a little bit about Genesis Psychiatric Solutions.
Right. Feel Good Services is an organization that provides mental health education to the public. And in doing so, we do have a YouTube channel. And what we do is we pick a mental health topic, right, or a condition, and then we talk about it. So we talk about the causes, the diagnosis, and then also how to treat it. And in treating, we usually talk more about what you can do at home, and then the need for medical attention also when you do need it. So the YouTube channel is Feel Good Services, is PHILGOOD, Feel Good Services, and that is what we do on there. We also on Facebook and other social media platforms. We
Thank you.
provide mental health educations to institutions like churches, organizations, any platform at all. If you reach out to us, the email address is feelgoodservices@gmail.com. Feel Good Services spelled the same way, PHILGOOD. Because I believe that if we're feeling good, productivity is going to be high.
No doubt about it. And thank you so much. I know I was in a hurry to say thank you because I thought you ended, but I want to truly thank you because what you're doing is phenomenal. I mean, that education all around for each and every one of us to be just self-aware of how important this is, especially if we're going to thrive in this new normal and become more efficient and be our best. So thank you for what you're doing. And my brother in Germany, by the way, just said he was a classmate of yours. He actually just
Oh, he
commented.
confirmed it.
Yeah,
Oh,
so I was like, small world, small world, small world. But yeah, thank you,
yeah.
thank you
All
so
right.
much. And
Anytime.
Dr. Lily, can you tell us a little bit about Genesis Psychiatric Solutions?
Yeah, Genesis Psychiatric Solutions has offices in McLean, Virginia, and Washington, D.C. So we're servicing the DMV, the D.C., Maryland, Virginia area. So in my practice, we customize our care towards our patients because it's all about you. And so I treat depressive disorders, bipolar disorders, obsessive compulsive disorders, ADHD, PTSD. And when you come into my office, I want to make sure that the patient knows that I'm hearing them, I'm listening to them. There's not going to be any double bookings. They're going to be able to, the time I spend with them is with them. And we collaborate together on their medications. And also try to see and I also try to see what how I could service them. And due to the times right now, we also offer telepsych services, which is virtual appointments. So you can meet me at the comforts of your own home, or if you're in your office, you can see me there. And that's the beauty of our practice is that we meet where our patients are, and we try to make it very convenient. And I have weekend hours as well. So I really try to make sure that I try to be as modern and also convenient for my patients.
Thank you. And I can vouch for this man right here. He truly cares about what he does. Like I said, he's like a big brother to me. He is a big brother to me. Had an opportunity to have known him for some years now. And I know that he truly, truly cares about. He actually lives what he's talking about. So thank you. Thank you so much. I know our time is fast spent. Can I just ask one last question? just from what just everybody just 30 seconds, please, before we leave. So I know you talked about, Phil, you go into organizations and institutions and really kind of working with them. And Dr. Lily, you handle from an individual standpoint. My question really is it advisable for an individual to just stick with one mental health professional in case they're working with somebody? Or do they get value in perhaps working with multiple people? Does that make sense? Because I'm kind of curious, like, is it really a longevity thing based on the relationship that's built over time? Or is it truly just so long as, I can just connect with different people? Is there value in one or the other?
I feel that either way is good. It bases on again the patient. So, like for example, I'm a psychiatrist, so I do medication management, and then I could collaborate with a therapist. So we have a collaboration where we're working together with the patient. Or if a patient prefers, you say, hey, doc, I prefer just to stick with you. Can you be my medication management and provide therapy? Then I would also offer that service for the patient. So it all depends. I try to customize the care for them and make it individual, because there's also some patients that may require community support, where they're getting a community support worker that's helping them make their appointments, apply for housing, apply for jobs, because due to their impairments from their mental illness.
So
Thank you.
in dealing with mental health, we're dealing with emotions and the mind, right? So you have to make sure that as a patient you connect with that individual. That is the first thing. So if I don't gel with you, it's okay to end that relationship and move on and look for someone that you really connect with that individual. That is huge on therapy, especially. The other thing also is if you stick with one person, then they know the history, and therefore are able to say that we've done X, Y, it didn't work, so this is what works now. They know the dynamics also. I always tell people that culture plays a part in mental health education, because there are certain things that you are not saying but you are implying. Okay, so if you keep moving around, then each person that you go to does not know what you are implying. They are only hearing what you are saying, which is not the full picture. But then we always need to know the full picture. So there are some patients that, as a provider, we know their families also, right? And because of the family dynamics, I do know that this is your trigger. Hence, in treating you, I'm considering the family dynamics also. But if you keep moving around, we're missing that pieces of the puzzle.
I see. Wow. Thank you, gentlemen. I know our time is fast spent. And again, for those who were able to tune in, we're truly grateful. If you want to connect with any of these gentlemen, they did provide their information as well. You can reach out directly to me, or you can go on to the bridge.leadership.room@gmail.com, send a message. I'll make sure I connect you to them as well. We would like to continue this discussion, even personally in our homes. Let's make sure that we're creating a high awareness, and to remember that empathy does not mean that you're feeling sorry for somebody, and that our personal biases can also get in the way when it comes to personal mental health and connecting with those that are around us. And last but not least, the greatest lesson I learned today is that our environments play a key role in our mental health. So I hope you are able to learn as much as I was. And I'm really grateful that you tuned in wherever you are. Until we meet again next month, I wish you a lovely weekend. And gentlemen, thank you once again.
You're welcome, sir.